On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here at the ACC annual meeting in Washington, D.C. for On the Scene. One of the questions that came out of the late-breaking clinical trials is what anticoagulant regimen is in fact superior. I'm here with Gerhard Richard from Germany. Gerhard, you did a trial. Tell me what this trial is about and what it was that you did to these patients.
It was a trial in STEMI patients, which came acutely to the cath lab, patients which were undergoing primary PCI. And we compared two regimens. One was the combination of Prasugrel and Bivalirudin, two novel drugs, one a novel antiplatelet and the other a novel anticoagulant drug. Both have 1A recommendations by the European and American guidelines. And this was compared with a classic combination with Clopidogrel and Heparin, which we use since years.
Now, it seems to me that most STEMI patients in the United States, at least before this trial, were given Bivalirudin. Is that correct?
Yes. But the combination with Prasugrel is a new option, and theoretically and intuitively, this is the better way to treat patients.
Okay, since it's intuitively the better way to treat patients, what in fact happened in your trial?
What in fact happened in our trial, which unfortunately had to be stopped early, but we didn't see any difference. We had a combined net clinical outcome, including myocardial infarctions, cardiac death, and bleeding, and urgent revascularization, and there was virtually no difference between both groups.
Okay, so is that that it was stopped because of futility, that it couldn't reach the endpoint, or why was it stopped?
No, it was slow enrollment. The study was sponsored by the institutions, not by the industry, and that made us that we didn't have the progress to enroll patients in that amount.
Okay, so the bottom line here is that there was really no difference in the two groups as far as the numbers were that you had together. So for everybody out there, tell me what you think the take-home message is here from this trial. What did you learn?
We learned that the combination of novel drugs, which per se have superior results in individual trials, not necessarily give more benefit if you combine them in the patients that they are recommended to take them.
Okay, so there you have it for new novel anticoagulants. Thank you, Dr. Richard.